Julie. I'm Karen Whitney. I'm a
Hi.
physician assistant with the practice.
Hi, nice to
and
meet
I'm going to go through your pre-op information with you today.
Okay, thanks.
Congratulations. It's an exciting procedure you're going to
It
have.
is.
I think you're going to be thrilled. Most people are a little bit nervous, a little bit anxious. My goal is to answer all of your questions ahead of time, put your mind at ease, and get you ready for your procedure, okay?
Good. Thank you.
So, the first thing we're going to start with is the informed consent. And you know, with any surgical procedure, we have to present every possible scenario to you. It can sound scary as you read over it. I want you to read it, ask me any questions. Keep in mind that if it has ever remotely occurred anywhere or might occur, we have to list that.
Okay.
So I'll have you read over this, and then I'll have you sign that.
Okay. I think Dr. Mendelsohn already hit on most of this, but.
Yeah, we try to cover everything in the consult.
Mhm. Okay. So I need to initial this then here. Let's see, okay. Okay.
Right, so some of these do not apply. You're not a smoker or not using an implant.
Okay,
So you
so I
can
don't
leave
have to worry
those
about that,
alone.
Okay, allergies.
And these are the only
Mhm.
allergies that you're aware of,
Mhm.
correct?
Mhm.
Okay.
Okay. Yes, I think I've asked all these questions. Okay. All right. What time it is? What time it is?
It's 3:15.
Okay. It asked for the time, so. Okay. There's that
Here.
one.
Okay, and then again, we've gone over this information with you, but just to be sure we have everything correct, I'm going to review your medical history
Okay.
briefly. We're going to be doing an advanced lift, and currently you're feeling well and have no medical issues. We do have your allergies listed as codeine, cephalexin, erythromycin, oxycodone, and sulfa, and acetaminophen, all of which can cause either nausea, vomiting, or a rash,
Mhm,
correct?
exactly.
So we'll be avoiding those medications. Can you list once again any medications, prescription,
Mhm.
or supplements that you're
Mhm.
taking?
I'm taking multi, calcium, E.
And do you know how much E?
Oh, I think it's 500 milligrams, but there's some in my multi too.
Okay.
D. I'm trying to think what I'm forgetting. Green tea and glucosamine chondroitin.
Okay.
And then I'm on a generic Lipitor for my cholesterol also. Low dose 10 milligrams.
Okay, great. And you do not smoke and do not drink excessively. And you do have a history of mitral valve prolapse, correct?
Yes.
Can you tell me a little bit more about that?
It got diagnosed like 20 years ago when I was having a tonsillectomy.
Okay.
And it's hereditary in my family, and my grandmother and my mother and I all have it, so I didn't even know I had it till I was about 36 years old.
Okay.
So it's never really given me any problems. I just know that I have it. When they listen to my heartbeat, they can hear it clicking.
Okay.
So.
And do you take preventative antibiotics when you go to the dentist?
You know, they stopped doing that a couple years ago. They used to always give me amoxicillin to take the day of, and they said, my dentist said it's not necessary anymore, so.
Okay. And do you see a cardiologist
No.
occasionally? Okay.
I had a physical in December though, and everything was fine, so.
Okay. Okay. Great. So, just to be certain, you do not have any respiratory problems?
No.
Right? And no history of bleeding tendencies, no history of a blood clot or deep vein thrombosis? Okay. And other than the mitral valve prolapse, no cardiovascular disease? Okay. And have you ever had a transfusion?
No.
All right. And any anesthesia?
Yes, I have had it for various procedures, and anesthesia usually makes me feel nauseous. Even when they give me that Pepsin and everything, I still always get sick from it.
Okay, well, the good thing is we're not
I
doing
know.
any anesthesia, so you're okay.
I'm glad.
And somewhere I saw you've had a hysterectomy as well as some ankle surgery, right? Okay.
Yes.
Good. Okay, wonderful. Wonderful. And we've got your height and weight. Okay, what I'd like to do is review your pre and post-op instructions with
Okay.
you, okay? And this is gonna go home with you, so you'll have everything with you. And between now and then, it's always a good idea to read over things 2 or 3 times. The more informed you feel, I think the more confident and comfortable you'll feel.
Okay.
People always feel a little bit anxious, and that's normal. And our
Okay.
goal is to put you completely at ease.
Okay.
Okay? And so, this is pre-op instructions. We do have you scheduled for February the 17th, and the nurse will call you the Thursday before in order to give you your arrival time for your procedure.
Okay.
Okay? And again, this is just, our goal here is to keep you well informed. You're not a smoker, so that's not an issue, correct?
Mm-hmm.
Okay,
Correct.
Great. And we do like all of our patients who are having an advanced lift to have a complimentary visit with our esthetician so that we can combine skincare with your procedure.
Oh, that's great.
And usually what we do, if you have time before, in this 3 weeks prior
Mhm.
to your surgery, you can have a visit with your esthetician. Otherwise, we can set it up about 2 weeks or so afterwards.
Okay.
And when you check out today, we'll set that up, okay? And so 2 weeks prior to your visit, we already know which medications you're taking, and we're gonna talk about which ones you should discontinue.
Okay.
You're gonna finish taking care of your payment today, and we would like, because of your mitral valve prolapse, to have a consent for surgery from your primary care physician.
Okay.
We'll let them know exactly what type of local numbing we're using, so that she's very well aware, she or he is well
Okay.
aware of what we're doing here. We do recommend that you take a multivitamin and vitamin C. You're on the multivitamin, so the 3 weeks before, 2 weeks before, if you add a vitamin C, it's gonna help with healing,
Okay.
help prevent discoloration after your surgery. Not likely in this kind of weather, but avoid sun exposure and certainly no tanning beds.
Okay.
And you do wanna have someone arranged to bring you to the office prior, for your surgery, and also be there to take you home.
Okay.
And then usually someone will bring you the following day for your 1-day post-op.
Okay.
Okay? If between now and then, if you get a cold, sore throat, fever blisters, or any skin eruptions on your face, let us know. It probably won't interfere with surgery, but we'd like to be aware so that we can give you extra instructions if we need to.
Okay.
Okay? So your vitamin E, you wanna quit taking.
Okay.
The multivitamin has some vitamin E in it, but that's not gonna be a problem
Okay.
for you. Okay? And also, it does not sound like you routinely take any aspirin, ibuprofen, Motrin, Aleve, Advil, but you should not take those for the 2 weeks before surgery.
Okay.
So if you do need something for pain relief, Tylenol or Tylenol extra strength is okay to take.
Okay.
Okay? Now, we have something here, the shopping list, but actually, we've done the shopping for you. We have some things in the
good.
bag, and basically what we have are the things that you're gonna need immediately after your
Okay.
procedure. Okay, so there's a baby shampoo in here, and we'll get into what you're
Perfect.
gonna do with that. Bacitracin or polysporin is the ointment you'll use. You do wanna avoid Neosporin because it can be irritating, and Q-tips and peroxide.
That's in there too? The-
Yes, so
okay.
everything's in the
No.
bag, so we'll send that home with you, so we're sure you've got the right
Great.
things, and then I'm gonna explain exactly what you do with them.
Okay.
Okay? So, the day before surgery, we're gonna give you your prescriptions today. The Z-Pak is the antibiotic. You're gonna begin taking that the day before your surgery, okay? Take it exactly as directed according to the directions, and make sure you finish the antibiotic. And that's just to cover us in the risk of any infection.
Okay.
This tramadol is for your pain relief. This will avoid the irritation to your stomach, right? And
Okay.
you're gonna take 1 to 2 tablets every 4 to 6 hours as needed for pain. What I would suggest is you start out with 1. If within an hour you're not getting some relief, take the second one. Generally a good idea to take them with some food in your stomach. Do not exceed more than 400 milligrams in the 24 hours.
Okay.
Okay? And that should certainly get you through. Now, if you don't need the prescription pain medicine, extra strength Tylenol is great.
Okay.
And we generally encourage, try to wean yourself off of that prescription as soon as you can. Okay? And then finally, there's some Ambien. That first night, it can be a little bit difficult to sleep. If you have difficulty sleeping, taking one of these at bedtime
Okay.
will be very helpful. So you want to have these filled and on hand the day of your surgery.
Is there generics for any of these, or does it matter?
It
Like
doesn't
the,
matter.
like the, I
Yeah,
know the
it doesn't matter, and you can
Okay.
usually request a generic.
Okay.
Okay.
Yeah.
Yeah, when you take the Ambien, make sure you're settled and ready for bed, because for some people it takes effect very quickly.
Okay.
Okay. So, you've been given the prescription for an antibiotic, take that the day before surgery and then continue until it's all gone, just as we talked about, okay? The morning of the surgery, we're gonna call you with your arrival time. We haven't determined that yet. You do wanna wash your hair, and you don't wanna use anything except the baby shampoo. Don't put any hair products on your hair. Don't cream rinse it, don't condition it. The reason is that we don't wanna risk that any of that will drip into your incisions afterwards.
Okay.
Okay, so just the baby shampoo. You're also gonna come in without any makeup, wigs, or jewelry.
Okay.
Okay? You should wear a shirt that buttons or zips up the front so that you don't have to pull it over your head. You wanna wear pants with an elastic waist for ease, and then comfortable shoes. No pantyhose.
No worries there.
No worries there, yeah. And you might wanna bring a scarf, sunglasses, a hooded jacket, or something to cover the dressings when you leave the office.
Okay.
Okay? You do wanna eat something for breakfast. It should be a light breakfast, get some nourishment into you, minimize caffeine intake.